To program the SecureSense algorithm, you will go to Brady parameters, and then leads, and then the SecureSense ventricular lead noise discrimination. And then you will see that 4 different parameters can be programmed. For the mode, there are 3 options. The first one is off, so no recording of the episode of noise and the therapies are not inhibited. Passive, then all the episodes of non-sustained or sustained noise will be recorded in the memory of the devices. There can be a warning for the patient with a vibration, but the therapies will not be inhibited. And then the last option, which is by default on. All the episodes will be recorded. There is going to be a remote monitoring alert and a vibration as a warning for the patient. And if there is a diagnosis of noise, the therapies will be inhibited. There are 2 possible configurations for the far field signals for the discrimination channel. The first one is coil to CAN and is the default setting. And there is this second option, VTIP to CAN. The integration of the distal electrode in the sensing vector for the discrimination channel may, however, limit the algorithm in its ability to prevent the delivery of inappropriate therapies due to lead dysfunction, since the distal electrode is included in the 2 sensing channel vectors, the bipolar channel and the discrimination channels. Therefore, the discordance between these 2 vectors is then less likely if a dysfunction involves the distal electrode. It is possible to program a timer to limit the maximum duration of inhibition of the therapies. It is nominally off, but you can program X seconds, and if the device diagnoses a sustained noise and inhibits the therapies in the first step, the therapies will be delivered at the end of this timer, even if there is a diagnosis of noise by the device. A single episode of sustained ventricular oversensing is required to trigger a remote monitoring alert or a warning for the patient, but you can program the number of non-sustained ventricular oversensing episodes to trigger an alert or a warning for the patient.